Hello, everyone. My name is Ahmed. I'm a third-year pathology resident, and today I'm going to be talking about the classification of B-lymphoblastic leukemia and lymphoma. So let's get started. Genetic abnormalities are nowadays the fundamental basis of the classification of B-lymphoblastic leukemia and lymphoma. Some entities can be defined by traditional karyotype or FISH analysis. However, other entities require next-generation sequencing or transcriptomics to identify defining abnormalities. Genetic abnormalities in B-lymphoblastic leukemia and lymphoma can be broadly classified according to the techniques that can define them most readily. These include genetic abnormalities evident with conventional cytogenetic techniques, genetic abnormalities not evident by conventional karyotyping, but can be diagnosed by FISH, genetic abnormalities defined by transcriptomic analysis and largely driven by chimeric gene fusions, other defined genetic alterations, and then if you have an entity that doesn't qualify any of these, then you can call it NOS, not otherwise specified. As for the first category of genetic abnormalities evident with conventional cytogenetic techniques, here we do have aneuploidy and recurrent rearrangements. Aneuploidy is defined as the gain or loss of chromosome numbers. If you have gain of chromosome numbers, you call that hyperdiploidy. And if you have loss of chromosome numbers, then you call that hypodiploidy. Aneuploidy in general is a defining feature in almost 30% of B-lymphoblastic leukemia lymphoma cases. As for the recurrent rearrangements, we have BCR-ABL1 fusion, KMT2A rearrangements, TCF3-PBX1 fusion, TCF3-HLF fusion, and IGH-IL3 fusion. Now, as for the second category, we have genetic abnormalities not evident by conventional karyotyping, but diagnosed by FISH. We have ETV6 RUNX1 fusion and intrachromosomal amplification of chromosome 21. As for genetic abnormalities defined by transcriptomic analysis, here we do have two entities. We have B-lymphoblastic leukemia lymphoma with BCR-ABL1-like features, and B-lymphoblastic leukemia lymphoma with ETV6 RUNX1-like features. These two entities resemble their established types, which are B-lymphoblastic leukemia lymphoma with BCR-ABL1 fusion and with ETV6 RUNX1 fusion. However, they have diverse underlying alterations identified by gene expression profiling. And because of this heterogeneity, screening for these disorders can be extremely challenging. Other defined genetic alterations include DUX4 rearrangement, MEF2D, ZNF384, NUTM1, and MYC rearrangements. And it also includes PAX5 alterations and PAX5 PADR alterations. As I said earlier, if you have an entity that doesn't fall under any of these categories, we call that B-lymphoblastic leukemia lymphoma not otherwise specified, or NOS. However, in order to make this diagnosis, you have to do an extensive cytogenetic and molecular workup. If you are unable to do a full workup for whatever reason, then in that case, we call it B-lymphoblastic leukemia lymphoma, not further classified. And we make this diagnosis to differentiate it from B-lymphoblastic leukemia lymphoma, NOS, in which you did all the workup and all the workup was negative. An important point in B-lymphoblastic leukemia lymphoma is that, unlike for myeloid neoplasms, a defined number of blasts in the blood or marrow is not a prerequisite for diagnosing B-lymphoblastic leukemia lymphoma. However, in practice, you should be careful to make a diagnosis when the blast count is less than 20%. However, on the other hand, there is no convincing evidence to suggest that outcome is adversely affected by deferring therapy until blasts reach 20%. This is the end of this video, and see you next time.